Well, that's right. Scripps Health says this upcoming consolidation, moving its labor and delivery operations from here in Chula Vista to Hillcrest, will help meet the rising number of emergency room patients here. But some patient advocates have concerns about this move.
But I think it's always concerning whenever we're talking about closing labor and delivery units, because what we're doing is we're essentially closing access.
San Diego Assemblymember Dr. Akilah Weber, who's also a practicing OBGYN, says this is one of a growing number of similar closures.
Unfortunately, where you're seeing up and down the state these labor and delivery units closing, there are communities that really need them there the most.
She says Scripps Health reached out to her earlier about this planned consolidation.
It's one of the first questions that I asked Scripps when they talked to me was, where are these patients going to go?
Under this plan, those patients would be referred to Scripps Mercy San Diego in Hillcrest. A spokesman for Scripps Health says that currently only about half the beds in the OB unit in Chula Vista are in use, while inpatient surgical beds are occupied at or beyond capacity.
I don't think it's a good idea.
South Bay resident Bernice Barreto says that many obstetrics patients who use Scripps Mercy Chula Vista rely on public transit to get there.
Because people around the south area, it's a little bit more closer, more convenient for them to come here, closer to their area where they live at.
Only one labor and delivery unit will now remain here in San Diego County's second largest city at Sharp Chula Vista.
We're going to be watching, can Sharp really absorb some of these patients that would normally go over to Scripps Chula Vista, and really see what that impact would be.
In the meantime, Dr. Weber is proposing new legislation that would require hospitals to give advance notice to the state before closing these units and provide a reason. Currently, state law requires 90 days notice. This bill would significantly increase that and also require an impact assessment on the community.
We need to make sure that as a state that we're helping keeping these very, very critical units open.
Also, keep in mind that emergency OB care will still be available here at Scripps Mercy Chula Vista even after the consolidation.